if I was a patient starting from beginning, the first thing I'd want to know is the people I'm going to see, are they board-certified plastic surgeons? I think that means a lot. I think it means they went through the rigors of the proper training to do this the right way.
Are there a lot of non-board certified plastic surgeons out there?
Yes. There are a lot of people who practice plastic surgery who are never went to a plastic surgery residency.
No. Come on. How would that work? Explain that to me.
So you can...
Could I become a plastic surgeon? I mean, could I do breast augmentations? I mean, I'm a physician.
You believe it or not, almost any specialty can do any specialty as long as they have a medical license.
Right.
So the question is, as a pulmonologist, can I prescribe Proventil or
right? But
yes.
that's prescription. But do a surgical.
Yes. So we have general surgeons in the country who breast augs. We have OBGYNs doing liposuction. We
dentists
have
that I see. Dentists, is that true? I saw.
We have dentists now doing Botox and fillers. It's actually legal in the state of Nevada. I have less of an issue with that. But you want to find someone who didn't do a weekend course. They've done real training and understand how to do these surgeries. And get it.
So board certified.
Board certification.
Okay, what else?
Okay. Second thing you'd want to look at, and you always have to look at it with some understanding that it's not everything, is an overall reviews of that physician.
Okay.
Right? Afterwards, you come in and you talk with that doctor. You should feel comfortable. You should feel that the patients coming in and out of the office while you're there seem happy, that patient that physician you feel comfortable, he's competent, he or she is competent in doing that surgery. And you can look at the before and afters and analyze them.
So would you say, like, I don't want to interrupt, but would you say, like, all the things we just went through, now maybe not in detail, but above the pec, but, below, I mean, all the different things we went through, not in that detail maybe, but would you would want that plastic surgeon to kind of at least touch on all the points we've touched?
Well, if a plastic surgeon is so busy that he walks in the room, says hi, and lets someone do the entire consult, and you never got to speak to him, him or her, you would probably not see a lot of that physician post-surgical, right? So you want someone who's going to be, you're investing in this process. You want someone to invest in you, and you want that person to be involved with your care, not just the surgeon.
Yeah.
Please, you got to remember, the patient's going to walk into that office post-operatively multiple times. They need to feel comfortable, not with just the surgeon, but with the staff.